Just a very, we need to move on to the next.
Yeah.
Sarge, thank you very much. Wonderful.
Absolutely. As next speaker, I like to invite Raul Caceres, a plastic surgeon from New York. He's an active member of the Keloid Research Foundation, and he will talk on non-surgical management of earlobe keloids, a patient-centered, multimodal approach. Please proceed.
It's okay.
Yeah, it's done. I'll read it. Good afternoon. First of all, I want to thank the committee that organized this meeting in Amsterdam. I know that takes a lot of work, and myself, I appreciate very much your effort. Oh, yeah, okay. Let's see. Sure. Otherwise, I can just read it because this in the picture coming. Well, the pictures I'll show you later, okay? Well, first of all, I would like to tell you that this case presentation, it will have a lot of red flags. So pay attention because now I will ask you, because usually you ask speakers, okay? So the patient is a Hispanic female who presented in July 2016 at the age of 26 with multiple ear keloids. Figure one will, like I said, will show all together. She reported a 6-year history of progressively enlarging lesions that developed several months after ear piercing at age 20. The lesions demonstrated a slow but continuous growth, resulting in 4 prominent keloid tumors associated with significant psychological distress, to the point that she quit school. She stayed in her room. Didn't want to go outside of the house, and severe depression, which is common in teenagers. Oh, that's right now. The reason is the letters are too small. That's why I had done this. Her prior treatments included 4 surgical excisions by plastic surgeons, adjuvant radiation therapy, and multiple courses of intralesional triamcinolone, all resulting in recurrences. Additional shaving and debulking procedures were also ineffective. Her medical history was notable for type 1 diabetes mellitus, polycystic ovary syndrome, and gout. A strong family history of keloid disorder was present, with her father affected. There was no history of cutaneous malignancy. On examination, she had long-standing treatment, refractory earlobe keloidal lesions with a clear traumatic etiology and genetic predisposition. At this point, I always want to emphasize this. There are many, no, I don't want to name the specialties, but people, they think that are Superman, have a cape, and they can fly and do whatever they want to do. And there are people, they have an ego, if it's clothing, very thick ego. And I want to tell you this because this patient at this time, when it came to see me, I think I want to take my ego, take my cape, and I said to her, I'm sorry, but I don't think I can help you. And she said, oh, we will recommend the Spanish people. They told us you're good. I'm telling you, I cannot help you. So what I did is I said, I heard about this doctor here in New York, because I'm in New York too. I think maybe that we should try, you and I, because he's very famous. Then, man, next appointment will be in 3 months. I'll make the appointment and I will take you there. So I went to Dr. Michael Tirgan's office and I said, I heard of you. I don't know you personally, but I cannot help this person with this history here. So please see what you can do. And I said, I'll wait outside. And I think for me, at that moment, I thought 4 surgeries, all you have. And you see the picture with the one that Tirgan put there. That is what she was in 2016. Now, I did a 10-year follow-up with Dr. Tirgan, and I learned a lot of things. So now, before I continue, because from here on will be Michael's patient, what were the red flags here with this system? We're talking about artificial intelligence and the basic concept for when you were a student is to take a good history and physical. And this was not done with this poor plastic fish. Sorry. Huh? Oh, okay. Wait. She wanted me to sit down. Sorry. I usually like to move around, but it's fine, no problem. So what were the red flags here? Let's be honest, we're talking about simple, not sophisticated things, which are the best people here, and I always thank the researchers. So what are the red flags here? What you heard before we continue? Those people, they never ask anything. They see this in knife. The second knife, that is one big red flag. 4 people, and nobody asked if there was somebody else in the family that maybe has keloids. You heard, right? The father had it. She was the first daughter, and normally Spanish people, they put the ears after a month or something. For some reason or religion, they say, oh, let's wait until she's 20 or a teenager. So there is the red flag. They never ask if anybody else or she had something else. And we were talking yesterday, I don't remember, it was Thursday, that somebody said, oh, a small lesion, don't biopsy. Right? You were here. These people did 4 times. And they did all this other stuff. Okay, so now she was treated with cryotherapy according to the KRF guidelines, undergoing multiple sessions over 18 months. Now, I heard somebody saying, oh, why this so long or this, that? We always criticize. For me, 4 people tried to do in 1 week, cut this, 1, 2, 3, 4 disasters. Now, this other treatment, yes, it's longer. You have to do every 3 months or so. It took 18 months. But if I'm a father, I'd rather wait a year and a half and you'll see the end result. These people, some of these people, I don't know if you know, even commit suicide. All right? Then the right earlobe returned to near normal appearance. Can you put the next picture, please, Rosa? Okay, now I have to stand up here. So you can see here, the right side, it looks great. But in the initial pictures, always the left was more bulky, etc. Now, it's not completely healed on here. And what happened is that and, on April 24, a minor recurrence on the left earlobe appeared. The next one, please, the next. And as you can see, can you lower it a little bit, please? Right above in there, if you notice something, is that because of all these procedures, on the left, the cartilage was damaged, a little small piece was missing, and that is why there, the healing and the recurrence occur. And then some people that do burns, if you don't have a good dermis, the epidermis is not going to look good. So it's something like this. Because over here, there was no damage to the cartilage, as you can see, and the result is better. And there's a lot of things, you know, they'll say, well, because of this, whatever. But here the problem is nobody asked if there was somebody else in the family with a keloid and did 4 times. I can see two, 3, 4. Maybe it's just for money or they don't care. I don't understand myself. Okay, now, so that's April 1924. So this year, somehow, I was always away. They are from my church, and they say, "Oh, you were here. Can we visit you?" So, to this year's 10 years, I'm following with Michael this place. So, following the treatment, this patient experienced complete resolution of her depression, regained confidence, and resumed normal social activities, reflecting a substantial improvement in quality of life. Sometimes we forget that. If we do this, that, whatever, what about the patient? And like I said, some of these girls sometimes commit suicide. So here it is, you might need to take longer treatment, whatever, but it's worthwhile to do that way than rather to just try to solve with a knife. And that is why I can tell you now that if somebody without a knife can have a better result than me, I salute Michael because he does a better job in this particular patient. Now, of course, we are not talking in general, right? So that is why this paper is non-surgical for lesions in the ears. Now, there are different things, they're more difficult, whatever. But I think myself, I learned a lesson that sometimes somebody, without being a surgeon, can get better results without being a surgeon. Now, the background, over several decades, multiple treatment modalities have been utilized to improve outcomes in patients with keloid lesions. Historically, surgical excisions combined with adjuvant therapies such as radiation, corticosteroid injections, pressure therapy, and laser treatments have been widely practiced. However, suboptimal outcomes and recurrence remains a significant concern, particularly for ear lesions in young patients. Clinical observations following exposure to cryotherapy-based treatments demonstrated improved cosmetic and psychological outcomes, prompting a shift toward non-surgical approaches. Methods. Clinical experience was evaluated based on longitudinal observations from surgical and burn care training. After I was general surgeon, plastic surgeon, I did 2 years at Hopkins in Baltimore. Hospital and leadership of burns in the unit of Harlem Hospital in New York, following collaboration initiated in 2016 with Dr. Michael Tirgan, patients with earlobe keloid lesions were treated using non-surgical modalities, including intralesional corticosteroid injections and cryotherapy. In parallel, an international collaboration was established between the Keloid Research Foundation and the burn unit in Oruro, Bolivia, with the goal of developing a structured treatment and research program. Plans were delayed due to the COVID-19 pandemic and resumed in 2025. A proposed treatment protocol includes cryotherapy for ear keloids, according to the data collection, is planned across multiple centers in Bolivia for comparative outcome analysis. Results. Clinical observations indicate that non-surgical management of earlobe keloids, particularly in young patients, results in improved cosmetic outcomes and reduces psychological distress compared to surgical approaches. Early experience suggests that a stepwise, minimally invasive approach may reduce recurrence risk and improve patient satisfaction. Additionally, preliminary field observations in Bolivia identified a substantial burden of untreated keloid lesions, highlighting the need for structured, accessible treatment protocols and data-driven approaches in undeserved populations. Conclusion, a non-surgical patient-centered and multimodal approach represents a promising strategy for the management of ear keloids. Tailoring treatments is based on individual patient factors, including age, prior therapies, and psychological impacts may optimize outcomes. Ongoing international collaboration aims to establish standardized protocols and generate data to guide evidence-based care, addressing the current lack of robust clinical trial data in keloid treatment management. Can you show okay, now this is very briefly, this is the town that I was born in Bolivia, and they have a lot of children that get burned because in a small place they live, they cook, they sleep, they do everything, so they always have a lot of injuries. So I built a burn unit in that space. Show the first, right there. This hospital is 100 years old. It's run by the government. The doctors are socialized medicine, so they work for the government. And there was a place for this garbage disposable. So the governor said to me, if you want to do it there. So there's the construction. The next, please. Next one. There. This is a burn unit similar to the one in Boston, next to the Mass General, emergency room, operating rooms, children, women, and adults in one place like they were supposed to be. Because in Bolivia, even in La Paz, in one hospital in one floor for children, in another hospital for women, another man for men, they don't have the money or they didn't think about. So this is the best infrastructure in Bolivia. And I invited Michael, he's been there. So what we're trying to do now is we'll make a protocol that is Michael's protocol that we are going to use, for instance, the injections. A lot of people say, oh, I do 50% concentration. Oh, no, I put the whole, everybody wants to do their own way. But we're going to try to follow this protocol in the whole country. In a year or two, we'll see what happens when some people try to follow one way. If it helps or not, that's a purpose that we're going to do. Thank you.
Thank you very much. Are there any questions? Comments? No, let's proceed. Yeah, we are running behind schedule. I want to invite the last speaker of the session, Dr. Patricia Yap from Jamaica, and she will talking about the use of topical treatment to treat keloid scars resulting from burn grafts from both donor and recipient sites. Please.
Okay. Do I have a mic? Can I speak?
You can use this mic if you want.
There's one there. Are these working?
Sure. You want my, you want my. No, that's not.
Okay.
You want to give it to you again?
Wait. Personnel is going, they move from at 7 o'clock. So that's why we asked to postpone it till tomorrow.
10 minutes, guys. You don't want to prolong this.
Okay, but because the personnel is only working till 7, and we are quite late.
Oh, okay, guys. No question asked. Everybody should ask me at dinner, okay? No question asked. Okay, so next slide.